جی اب کیا اس نے شیئر وہ نہیں جوائن کیا ہوا عزیر نے، اس کا ویٹ کریں.
جی سر ویٹ کر لیتے ہیں، میں کانٹیکٹ کرتا ہوں ان سے اگین اور پھر ہم اسٹارٹ کرتے ہیں.
ٹھیک ہے. अहमद इस तरह करते हैं कि हम स्टार्ट करते हैं, उसका अब मजीद वेट नहीं कर सकते क्योंकि टाइम डिले हो रहा है, पार्टिसिपेंट भी काफ़ी जो है परेशान हो चुके होंगे।
जी सर, आई थिंक वी शुड स्टार्ट। शायद डॉक्टर उजैर का कोई नेटवर्क इशू है, इस वजह से वो ज्वाइन नहीं कर पा रहे।
ठीक है, so may I start now?
यस सर, प्लीज स्टार्ट।
Okay. बिस्मिल्लाहिर्रहमानिर्रहीम। قال سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. Today's webinar is on the roadmap of vascular ultrasound. This is true, interesting, and basic prerequisite for the upcoming webinars on vascular ultrasound. So, in this context, this is too important. And I'm really thankful to all the participants from everywhere, from all parts of the world. And I'm too grateful and thankful to Professor Said Amir Gilani, who provided us this platform to share knowledge across the world. And I'm also very thankful to all the organizing members and committee of this webinar of Afro-Asian Institute. So this webinar is very interesting and hope you will enjoy it. So during this webinar, we are going to use the state-of-the-art platform information technology, but we'll use the conventional method of teaching. I'll write most of the thing, I'll draw most of the diagram on the screen, you'll enjoy it. So Dr. Uzair was the moderator of this webinar, but unfortunately he has some connectivity issue. That's why he didn't join us, and hopefully he'll join us soon. So in this webinar, we will discuss some of the important topics. We'll a little bit discuss about hemodynamics. With me as well. Are you hearing me? Ahmed, are you hearing me?
Yes sir, I am hearing you sir.
Okay.
Dr. Uzair is here.
So, welcome, Dr. Zair.
Yes. Should I start?
Yes, sure.
Yes, Dr. Uzair, we should start.
Okay. I'm starting. Bismillahirrahmanirrahim. I hope everyone can hear me. My name is Dr. Mohammad Uzair. I am a lecturer in the University of Lahore, and currently I am working as a I'm working in Afro-Asian Institute. I am a moderator for this webinar, that is Roadmap of Vascular Ultrasound. Today, our chief guest speaker is Dr. Raham Bacha. He is author of many books and has done many international journals, has publication in many international journals. Now I am handing over the screen to Sir Raham Bacha. Kindly, sir, over to you.
Thank you very much, Dr. Zair. I'm very thankful to all the organizing members of the webinar, and especially to Professor Dr. Said Amir Gilani, who provided us this platform to share knowledge across the world. قالوا سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم. ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. So today's episode of Vascular Ultrasound. This is a basic lecture and prerequisite for upcoming webinars and vascular ultrasound. So hopefully you enjoy this lecture very well. And this webinar will discuss about hemodynamics, low resistant and high resistant blood flow, water pump and pipes for the distribution of water is an example of blood flow in the body, arterial and venous blood flow, spectral worm formation, stenosis, an example of road and traffic. So first of all, we'll discuss about the hemodynamics. So here in this image, you can see this is a heart and the blood is pumped to the systemic circulation as well as pulmonary circulation. That's led through the body and collect with the help of small veins, then they join each other to form large veins, and these large veins in turn combine with each other to form inferior and superior vena cava and pour the blood to the right atrium. This way, the blood circulates in the body, but in case of vascular ultrasound, we are going to map the flow of this blood in the form of spectra. So here in this image, you can see this is a spectra is made one x-axis, where here in this image you can see this represent the time, the other axis which is on the vertical axis that represent the velocity. In time, the number of these fluctuation excursion of the heart. Just for example, the number of beats the heart perform in a short period of time. Whenever heart start contraction, so the velocity of the blood and the vessel become increases, and finally it reaches its peak velocity, which is the top of this image. You can see this is the highest blood flow during the ventricular contraction. After the ventricular contraction is completed, then ventricular relaxation is started.
सॉरी टू
So from
डिस्टर्ब यू
here,
सर, आपकी आवाज़ डिस्टॉर्शन हो रही है, क्लियर नहीं है और आपकी वीडियो विजिबल नहीं है।
अच्छा मेरी वीडियो, लेकिन मुझे तो इधर नजर आ रही है।
सर यहाँ पे ना आपकी ना नेटवर्क बैंडविड्थ लो आ रही है, पॉसिबिलिटी कि आपका इंटरनेट पीछे से जो है ना इतना स्ट्रांग नहीं आ रहा, सो काइंडली आप अपना इंटरनेट थोड़ा सा मैं पहले ये देखना चाह रहा था कि ये किस जगह से आ रहा है, लेकिन ये आपकी साइड से ही शायद है। क्योंकि
अब मेरी वीडियो आ रही है?
नहीं सर।
और मेरा स्क्रीन शेयर हो रहा है?
नहीं सर, आपकी स्क्रीन शेयर भी नहीं हो रही।
अच्छा, तो मैं इतना जो है मतलब यही बोल रहा हूँ। अब शेयर हो गई?
यस सर, अब हुई है शेयर।
ठीक होगी, सही। Here now?
Yes, sir.
Okay. So here you can see during the heart contraction, the blood is pumped or pushed towards the systemic as well as the pulmonary circulation, as you can see in the image. And the image, which is the schematic diagram over here, you can see the x-axis which represents the time, and the y-axis, this is the x-axis which represents time, and this is the y-axis which represents velocity. During heart contraction, the heart starts contraction, the velocity of the blood in the vessel starts increase, and it reaches its peak velocity, which is this region. And after that, the ventricle become start to relax. So this is ventricular relaxation. From here to here, this is ventricular contraction, and onward it is ventricular relaxation. So during this time, the velocity of the blood once again decreases and reaches to its lowest portion. Then once again, the arterial recoiling of the main arteries, which are elastic arteries, it starts its contraction, and during this arterial recoiling, the blood is flowing once again forward during diastole. So from here to here, after the start of the next systole, this is the systolic phase of diastole. So during this diastole, we have the lowest blood flow velocity and arterial recoiling. The blood flow occur during this phase. This is due to arterial recoiling. Here in the image, you can see again the blood is flowing from the right ventricle towards the pulmonary circulation, and from the left ventricle towards the systemic circulation. Once the blood is reached its terminal part to reach, and all the arteries become capillaries. So these capillaries, at this capillary level, you
Sir
can
Raham, sorry to disturb you, but Sir Raham, can you listen? Sir Raham, can you hear me?
Yes,
Your
sure.
voice is breaking, sir.
Okay.
Your voice is breaking.
I have to change my connection.
Just
Mm, just wait, I'm changing my connection. Maybe
okay, sir.
are you hearing me now?
Yes, sir. We should wait for you.
And my presentation, is it visible to you?
No, sir, the voice is again breaking. I cannot hear you clearly.
Okay. Are you hearing me now?
Sir, there is still a problem in your voice quality. It's very low. Maybe the internet connection, I don't know, but something is wrong there. Hello, can you hear me, sir? Sir Raham? Sorry, I think the voice quality is very low.
Are you hearing me?
Yes, sir. Now I can hear you. And the voice is clearer than before.
Okay, here you can see the blood is pumped by the right ventricle towards the pulmonary circulation, and from the left ventricle towards the systemic circulation. At the terminal part of the arteries, the vessels
Sorry, audience, there is
Jaddu.
an issue in the internet. Sir, your internet connection is not stable, I guess.
Okay, are you hearing me?
Yes, now we can hear you. Sir?
G.
Okay, you're online.
Are you hearing me now?
Yes, sir, but the voice is again breaking. I don't know what is the reason, but there's a problem with the
Okay,
internet
I'm
connection, maybe.
just changing the place of my this device. Okay, just wait for.
सेमिनार चल रहा है, वेबिनार यहाँ पे मंगवा दो. Hello, Sir Raham. Your screen share is not visible, but we can see you clearly. And I cannot hear your voice. You are on mute, sir. Sir, you are on mute.
Okay, now are you hearing me?
Yes. Now your screen is very clear. We can see you clearly, and your
Yes.
voice too.
Okay, I'm sharing my screen as well.
Okay, sir.
Is it okay now?
Yes, sir.
So we were talking about the hemodynamics, and during this hemodynamics, the blood is brought back towards the right atrium by the superior and inferior vena cava, and then that deoxygenated blood is sent to the right ventricle, and through this right ventricle, it is pumped towards the pulmonary circulation. So if we talk about the laminar flow, so here you can see in this image, during laminar flow, different lamina blood flowing in the vessel at different velocity due to difference in resistance. As the boundary lamina are all these lamina which are near to the vessel wall. Just for example, I'll show you with the help of this pen. All the lamina which are near to the vessel wall, they're slower due to the friction of the blood with the vessel wall, because the vessel wall is static and blood is flowing against that static wall. So it will get resistance, and due to that resistance, it will slow down. But as compared to the boundary lamina, the central lamina have very low resistance and they are moving fast as compared to its adjacent lamina. So we'll have variety of blood flow at the same time in the same vessel. And if we draw the spectra for this sample size, which is just for example over here, I'm changing the color of my pen, which is red. So I'll select yellow one, okay? So this one is the Doppler line, spectral Doppler line, and this is sample volume, and all the lamina in between the sample volume. These are over here in this case, in this parabolic flow, a laminar flow, you can say. There are a variety of velocities measured with the help of the spectra. So we will have variety of these velocities in the spectra as well. So here you can see if x-axis represent the time, y-axis represent the excursion, contraction or the velocity. So during heart contraction, we will have spectra like this. And whenever heart reached its peak contraction, then it will start relaxation and the velocity will become slow down. But during this heart contraction, if we take our sample away from the heart, just for example, in the abdominal aorta, in the upper limb, brachial artery, and so on, so we'll have such type of spectra. Okay, so at the same time, just for example, we are taking this time. So at this time, we have lowest velocity as well as highest velocity because due to the variation in the velocity of different lamina. Just for example, the central lamina, which is fast, that will be represented by this fast velocity, and the boundary lamina, which is inside the sample volume, that will be represented by this one. So we'll have a spectral window and spectral broadening. So here you can see this is spectral broadening, and this broadening is brought about by the variety of blood flow velocities in the same sample volume at the same time. So the spectra was made due to this variety of blood flow. So we will have a lot of vessel and they will have a laminar flow. So during that laminar flow, we will have different velocity of the different lamina and the same sample volume. That's why we will have this broad spectra. And the large vessel, this broadening of the spectra will also be pathological. But in the small vessel, away from the heart, these broad spectra are not pathological, and these will be brought about due to the normal physiologic function, normal physiologically due to variety of blood flow in the small vessels. So we'll have broad spectra in the small vessel and narrow spectra and the arteries near to the heart. Then we have low and high resistive blood flow. You know about the low and high resistive blood flow, but here in this screen, uh, I will draw the images or the spectra of the low resistive and the high resistive. So first of all, we should know about what type of blood flow should be to what type of organ. So we have mainly two type of organs, vital organs and non-vital organs. So vital organs are those organs which are at most important for the life of an individual. So to those organs, there must be blood flow during systole as well as diastole. So if I draw once again, the x-axis represent the time, the y-axis represent the velocity. So in case of low resistive flow, there will be forward flow during systole as well as diastole. So there will be forward flow. And this baseline shows that the flow above the baseline will be to one side and below the baseline will be to the other side. But if we have blood flow in a vessel at one side, at one direction, that will always be at that direction during systole as well as diastole. And this type of blood flow is called low resistive blood flow. As you can see, in cases of renal artery blood flow, umbilical artery blood flow, carotid arteries blood flow, because all those organs are supplying vital organs. But if we take spectra of the lower limb arteries or the upper limb arteries, so they are supplying to the muscular bed. And if the person is not involved in physical activities, so there will be high resistive blood flow and we will have spectra like this. Just for example, during systole, there will be forward blood flow, but during relaxation of the heart, during diastole, there will be a reverse of blood flow. Just for example, blood was pushed by the heart against a resistive vascular bed, but when the heart was relaxed, so some of the blood was pushed back by the resistive vascular bed. So this reversal represent that amount of blood which was pushed by the resistive vascular bed. And this amount of blood, this reversal of blood, the amount of this reversal represent the resistance of the vascular bed, to what extent the vascular bed is resistant. And again, during arterial recoiling, this forward blood flow will again be resumed. We can say that this is high resistive vascular bed and this is low resistive vascular bed. But this this resistance is comparative term, and we can say if this blood flow is normal in the kidney, so any blood flow, just for example, it's diastole reaches to the baseline, that will be abnormal. Just for example, if this one is normal, so this is abnormal. Although in this case, the blood flow during diastole is is above the baseline, that is not reversal, but actually the kidney is a low resistive vascular bed, so there must be forward flow during systole as well as diastole. And if there is a resistance in the kidney, so during diastole, the blood flow will touches or reaches to the baseline. So that will be abnormal. We can give an example of the water pump and pipes which are used for the distribution of water. So we can have that an example for the blood flow in the human body. Just for example, if the heart is working like a pump, which was there in an example of water, which was water pump. But the entire example of water pump and pipes could not be applied on a living human body, because in case of human body, there will be homeostasis, and most of the physical and clinical insults will be minimized to a great extent by the homeostasis of the human being. Just for example, we are talking about any stenosis, which is going up to 60 or 70%. So that is called hemodynamically non-significant. So by hemodynamically non-significant stenosis, we mean that hemodynamics will be not affected. Even just for example, if the vessel lumen is like this, and this is occluded up to 50%, just for example, half of the vessel lumen is occluded, and the remaining half will also have blood flow, but that blood flow will not be affected even by that 50% of the occlusion of the vessel. That's why this is called hemodynamically non-significant stenosis. But any stenosis which is more than 50 or 60%, then hemodynamics will be affected. The velocity of the blood flow will be affected, and pressure will be affected. That's why this is called hemodynamically significant stenosis. So we can't give this example totally. We can only give this example up to the understanding, but this example could not be adopted by the human body, because there is a difference between pipes and water pump and heart pump and vessels, because there is another system in the human body which is called homeostasis. So homeostasis minimized to multiple insults to a great extent. Okay. So in case of water pump, whenever the pump is pushed against the pipe, that is the velocity of the water in the pipes will increase. In the same way, whenever the blood is pushed by the heart in the blood vessels, so the velocity of the blood will increase in the vessel. Then we have arterial and venous blood flow. How to differentiate between arterial and venous blood flow? Most of the students even don't know about the arterial and venous blood flow. So this is a very concerning problem because this is at most important differentiation between the arterial and venous blood flow. As you know, arterial blood is pushed by the heart, by the ventricle, but there is no pump just like heart to the venous system that could push rhythmically blood towards the heart. So the arterial blood have uh, specific cardiac activities just like this. During contraction of the ventricle, the blood flow velocity will increase, and during relaxation of the heart, the velocity will again decrease. So these cardiac activities will appear in the arterial blood, but in venous blood, there will be no cardiac activities. And even if the cardiac activities were detected in the venous blood, unless apart from the central veins, just for example, IVC, hepatic veins, and jugular vein, so that will be pathological. But these cardiac activities will be experienced in these central veins. So the venous blood will be steady blood. There will be respiratory variation. During respiration, during inspiration, the diaphragm lower down, the abdominal pressure increases. That's why the abdominal IVC will collapse, and the extra blood which is present in the IVC will be pushed, but that blood will not flow back due to the valves present in the venous system. So the blood will be pushed forward towards the heart. But during expiration, the diaphragm will up down, the intra-abdominal pressure will release, the IVC will open, and it will suck blood from the distal part of the body. And some of the blood will come back towards the IVC from the right atrium because there is no valve between the IVC, SVC, and right atrium. So this type of blood flow will be present in the veins, while this type of blood flow will be present in the arteries. So the arterial blood flow will have clear-cut cardiac activities, but the venous blood flow will have respiratory phasicity. And these respiratory phasicity will be slow as compared to the cardiac activity. As you know, heart rate is almost 70 to 80 beats per minute, but respiratory rate is almost 18 to 20 times per minute. So the respiratory physicity will be apart from each other, and the cardiac activities will be near to each other. Therefore, we are using a slow sweep speed for the venous examination and fast sweep speed for the arterial examination, as we have already discussed about the sweep speed in my previous lecture, which you can uh, um, uh, listen once again through YouTube, which is on the page of Afro-Asian Institute. So there is a clear-cut difference between the arterial and the venous blood flow. There must be respiratory variation and the venous blood flow, and there will be cardiac activities and the arterial blood flow. So there must be some changes. You can say if there is arteriovenous fistula, so the blood flow will change. But during this lecture, we will not discuss about that because we will discuss in the upcoming lectures. This is prerequisite for those lectures, so this is important. You should know about this. Spectral, how a spectra is formed. As you already know, just for example, you are taking the sample volume and a vessel, and that vessel is near to heart. And just imagine this is heart, and the blood flow is in this aorta, and you take the sample volume at this portion of the vessel. So it's mean this is near to the heart, and while taking a sample volume near to the heart, you will have, just for example, narrow spectra. There will be no spectral broadening. Just for example, you will have blood flow like this. So the spectra will be like this because the blood is pushed by the heart, and almost all the laminas are at almost the same velocity at this region. But as we are moving farther from the heart, and just for example, we are taking a sample of the brachial artery. So just for example, this is brachial artery, and we take the sample of this brachial artery for the spectral waveform. So we will have a broad spectrum over here because you will have different variety of velocities in our sample volume, because this is away the heart. And now the resistance between the vessel wall and the boundary lamina is brought about by the movement of the blood against the vessel wall, and that is farther from the heart. That's why more resistance was created by the vessel wall, and the boundary lamina was slow as compared to the central lamina. That's why there is slow flow as well as fast flow, and the spectra become broad now. But just for example, there is any stenosis over here, and we are taking a spectra before the stenosis and after the stenosis. So what will happen? Just for example, there is a stenosis, and the heart push the blood against this stenosis. So this vessel will slightly dilate, and the blood will be pushed against this stenosis. So the extra amount of blood will reserve in this vessel. And whenever the heart relax, so this extra amount of blood will flow back. And if we have our sample volume over here, so we'll have forward flow during systole because that was pushed by the heart against the stenosis. But as the heart was relaxed, so that blood will move backward. So there will be large backward flow below the baseline blood flow during diastole. So this is diastole, and during this diastole, there is backward blood flow. This is due to the stenosis. If you take proximal to stenosis, so we will have high resistive blood flow because the blood was pushed back by the stenosis, or the extra amount of blood which was reserved in the vessel before the stenosis. That's why we got high resistive blood flow. But if we take sample volume after the stenosis, so what will happen? We have to change our slide so we'll get better image. Just for example, this is a vessel, and there is a hemodynamically significant stenosis in this vessel at this region. And we have taken the sample volume after the stenosis over here. So at this region, the, the blood first was pushed by the heart against this stenosis. Extra amount of blood was accumulated over here. And whenever the heart was relaxed, so some of the blood was pushed back by this stenosis or by the arterial recoiling, because this artery was the walls of the artery were pushed by the blood, by the hydrostatic pressure of the blood. But now this is not complete occlusion. This is a stenosis. There is a small lumina vessel which is patent. So this extra amount of blood will move resistantly forward, and we'll have uh, um, uh, 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 cardiac activity, which will be late and low. As we have already discussed that this x-axis shows time, so this will be a late excursion, a late increase in velocity. So that increase in velocity take much more time, and then after the heart relaxation, there will again be forward flow of the blood, although the velocity will be slightly reduced. So this will again move like this. And this type of blood flow is called tardus parvus waveform, late and low blood flow. This late and low blood flow was caused by this stenosis. So if we have any blood flow like this, so we have to search for any stenosis proximal to our sampling site. We have sampled over here and we got flow like this. So we have to move backward towards the heart and the vessel, and we will search for any stenosis. But if we got blood flow like the previous slide, as you can see in this, if you we got blood flow like this, high resistive blood flow, so we should move forward to search for any stenosis in the vessel. So spectra will form like this, and if we have a sample volume at the region of stenosis, so if there is a very small lumen which is patent and the rest of the lumen is occluded, so there will be forward flow, and this forward flow will be high velocity flow. This high velocity flow will be during systole as well as diastole. So you will have forward flow during systole as well as diastole at the region of the stenosis, and that flow will be too fast. And along with that fast flow, there will be broad spectra, because at this stenotic region, there will be some slow flow, some very fast flow, and that's why there will be broad spectra at the region of the stenosis. Just for example, if you take an example of the roads and traffic on it, just imagine we are driving and reach to a traffic signal, and that is red. So we will stay over here, although the road is now open and there is no traffic at all, but you will have to obey this signal. And whenever the signal is green, then we will move. So there will be a gush of vehicles, blood towards the open vessels or the open roads. So there will be, if there is any signal on a road, so there will be periodic increase and decrease in the number of vehicles on that very particular road. But if there is no signal at all in a road, so the periodicity of the vehicles will not be observed over there. And if you are very near to the traffic signal over here, so you will observe this periodicity very well as compared to you are moving farther from the traffic signal. So you will observe that periodicity comparatively less than near to the traffic signal. The same way, if you have taken sample near to the heart, so there will be great periodicity or great increase and decrease in velocity.
Dr. Raham, can you hear me? Dr. Raham Bacha? Sir? Sir, can you hear me? Sorry, Sir Raham cannot hear us. Maybe there's a network issue or something. He will be with us shortly. Saraham, can you hear me? Sir, your microphone is off. Sir, can you hear me? Saraham? Dr. Raham Bacha, can you hear
Yeah,
me?
I'm hearing you. Yeah, I'm hearing you. Are you hearing me?
Yes, yes, I can hear you clearly, sir, and I can see you as well.
This is a great problem.
What happened, sir?
Okay. So once again, I'll come.
Sir, we cannot see your screen.
But I have shared what happened to it.
We are just seeing a black screen saying Dr. Raham Bacha has started screen sharing and nothing else. We can see
Okay, I'm
you right
sharing.
now, but
I'm
yes,
sharing.
sir.
I'm sharing once again.
Yes, yes, sir. So can you change the slide or something? Because there's only one thing saying Dr. Raham Bacha has started screen sharing and nothing else is visible.
Is it shared now?
Sir, I cannot see any of your slides. I'm just seeing a text saying Dr. Raham Bacha has started screen sharing.
Okay, I'm just changing it. I'm going to fix the problem, but it's
What's happening, sir?
Don't know about that. I'm sharing once again.
Yes, sir.
I'm not seeing my slides on the screen. Okay. Is it shared now?
Sir, the same text appearing that was appearing before. Dr. Raham Bacha has started screen sharing and nothing else is on the screen. Can you please move the slide one or two slides forward? No, there's no change in that specific text.
But I have changed all the slides.
Sir, if you want, you can reconnect. You can disconnect and then you can reconnect again.
Yes, sure. That will be.
Maybe that. Now the screen is shared, sir. Now I can see the screen, sir. Now. Yes, sir. The screen share is visible.
What screen do you have now?
Roadmap of vascular ultrasound, hemodynamics,
And,
spectral waveform, heart.
okay, okay. So I was at the end of my slides, and I was just giving you an example of the roads and the traffic. Okay. Are you hearing me?
Sir, we can hear you. We can hear you clearly, sir, and we can see the screen as well.
Okay. Just for example, there is a road and there is something wrong in the road, whatever it may be, but there is some stenosis in the road. Okay. So what will happen? A lot of vehicle will be over here. They will try to escape through different ways. So whenever they got some other small paths like this one, so some vehicle will move through these small paths and they will join the main road at any place distal to the stenosis. And these are the routine which you are going to observe every day. So these are actually collaterals, okay? But during this collateral vasculature, there will be again loss in periodicity. Just for example, vehicles are coming from this way, from this way, and some are escaping from the stenotic region and they are coming through this way. So all the time there will be movement of vehicles on the road at this location. So if there is any stenosis in the vessel and blood is accumulated over here, so they will try to search for any opening, any small branch, and they will move through that small branch, and that small branch will be large. They will become collateral and will join the main vessel if needed later on. So if we take our sample over here after the joining of the collateral, so we'll always have forward flow, and even sometime we'll have blood flow like veins as well at this vessel. That will be due to all the time there will be forward blood flow and there will be no periodicity of the heart or the heart contractility, because the heart activity will come over here at some time else, but they will come over here to some time else. So all the time after the stenosis, there will be forward blood flow, and that forward blood flow will be low resistive blood flow. So these were about today's lecture. Although I had no preparation for today's lecture, that was the interest of the lecture, which I already told that you will enjoy it too much, and we'll have today's lecture on the screen as a blackboard. And I tried to make a lot of images and traces. Hope you would enjoy it. Thank you
Yes,
very
sir.
much.
Yes, sir. We enjoyed it a lot. Thank you very much for your time. Now I have one question from the audience, if you care to answer. First one, the question is, sir, how can we differentiate venous flow normal and when there is a thrombus in it?
Normal and abnormal venous blood flow.
Yes.
Are you talking about that?
Yes. Yes. When there is a thrombus in the vein and when the venous flow is normal.
Okay. If you're talking about any thrombus, just for example, in the lower limb, I mean, you are talking about DVT. So there will be dilated perforators, and there will be no respiratory variation and the blood flow away from the thrombus. Proximal to the thrombus, there will be respiratory variation, but away from the thrombus, there will be loss in respiratory variation, and that is a rule of thumb. If you have no respiratory variation in the venous blood flow, then there will be something wrong proximal to your sampling site.
Thank you, sir. Thank you very much. That's enough for today. I hope our audience has understand this lecture well. This lecture was available live on Facebook. We have given the link in the chat for the Facebook page of Afro-Asian Institute, for the Instagram page of Afro-Asian Institute, and for our YouTube channel. This lecture will be uploaded on our YouTube channel after a few days. And you can also go to our site for latest updates about the few paid or free webinars. Thank you very much for your time, everyone. Thank you very much, Sir Raham Bacha, again for your time.
Thank you
Thank you
very
very much.
much. Thank you.